Hi class, we're going to be talking about anxiety. So welcome to Anxiety with Professor Leonard. These are going to be our learning outcomes. Please be able to understand the following information after viewing the PowerPoint lesson. What is anxiety? What are the different types of anxiety? What are some of the anxiety disorders? Be able to understand the physical and emotional symptoms of anxiety. Understand parasympathetic and sympathetic nervous system and how that affects when you have anxiety, the fight or flight response, the general adaptation syndrome, treatment modalities used in therapy to help people with anxiety, also famous people that may suffer from anxiety, and think about ways to manage your anxiety. One of the activities I would like you to do is to please go to the next clip, which is the anxiety inventory. I want you to be able to print this out and bring this in to your next class meeting for your entrance ticket. Please make sure you are honest when you answer these questions. Answer the questions as best that you can. This is a screening or a scale to kind of look at your own anxiety level. And then we will discuss this further when you come to class. How many of you have been in situations before where you're waiting in line? It could be financial aid office, it could be the grocery store, it could be anywhere. Think about how anxiety and stress affects your body. Think about who you want to be. Do you want to be this guy right here? Or do you want to be this grumpy guy? Or do you want to be this person who's able to manage the stress and anxiety level and keep it under control? You are the person who controls your own anxiety and stress level, no matter what situation you might be in. One of the things that we're going to talk about is this is called the stress avoidance model. I've begun a stress management program. I'm staying in bed for the next 10 months. Probably not the best way to manage your stress. Because this is the avoidance model, you're not really dealing with your stress and anxiety, but going back to bed and pulling the covers right on top of you, and that's probably not going to be the best way to handle your stress and anxiety. In fact, class, this makes your anxiety and stress even worse. Your fight or flight, this is where in 1935 Walter Cannon coined the term fight or flight. This is the way your body reacts to the stress hormone in a stressful situation. Are you ready to fight or are you going to flee? Think about it the way I learned it in school. If a bear jumps out in front of you, are you going to run? Are you going to stay there? Because this is the burst of energy, and this is what kind of affects your body when it comes to the symptoms. What are some symptoms of anxiety? Pounding heart, dry mouth, migraine headaches. I'm sure most of you could probably contest that you've had some type of headache, stomach issues, and all of this, guys, is actually symptoms of anxiety. A pounding heart, this could be even an example of a panic attack, if you know what a panic attack is, where you feel hot flashes and dizziness and short of breath. This is something that you need to be cautious of because these are some of the symptoms of anxiety. Also, emotional signs of anxiety. Frequent feelings of boredom, not being able to concentrate, feeling overwhelmed, tendency to feel anxious, tendency to be irritable, very tired, lethargic all the time, and anxiety. A person may become irritable and angry and tense. They can possibly lead to things that are like negative behavior, like physical, drug abuse, emotional abuse, and they become very angry and frustrated. So these are some results of anger and frustration when you become very anxious. What does this illustrate, everyone? The poor zebra is losing his stripes. Guys, this is actually a very good example. The zebra is losing his stripes, and what happens when you really have a high sense of anxiety and stress, your hair can fall out. No, not trichotillomania where you're pulling your hair out, but your hair can fall out and start breaking because of stress. This is called the general adaptation syndrome, and the therapist's name was Hans Selye. And what he talked about was your body's reaction kind of going back to the fight or flight. This is where your body's going to feel when your body's getting in that stress and how it affects your immune system. When you're in the alarm, your body's getting ready for that stressful situation. Resistance means you're dealing with that situation, and then exhaustion, when your body just finally collapses. My question to you to think about is, what do you think would happen if your body was under a high state of arousal for a long period of time? Yes, you guessed it, your body would be under that state of exhaustion so much that your body would just actually collapse. And that's kind of what affects the sympathetic nervous system. That's your sympathetic nervous system versus the parasympathetic. Your parasympathetic is what actually quiets your body. It calms you down after the stressful situation. However, the sympathetic nervous system is what arouses your body, and that's what causes all your stress hormones. If you've heard of cortisol, that increases your heart rate, increases the perspiration. It makes your body want to get into that fight or flight mode. And that's where, for a long period of time, your body then gets into exhaustion. What are some examples of anxiety disorders? This is important that you understand the different anxiety disorders, the most common anxiety disorders, because you will be able to learn how to illustrate these anxiety disorders and look at real life world examples of these disorders. One is a panic disorder with or without agoraphobia, and a panic disorder with or without agoraphobia. Agoraphobia is Latin for marketplace, so it actually is a fear of open spaces. Panic disorder is like a panic attack. If you've heard of a panic attack, that's actually what a panic disorder is. A specific phobia, that could be a phobia on anything. Agoraphobia, a specific phobia, fear of open spaces, claustrophobia, fear of heights. Social phobias, fear of like social anxiety, being around people. And this is actually one of the biggest phobias you see in college students is social anxiety. Obsessive compulsive disorder. And you're going to see a very good example in the Ed puzzle when you get to that link on a really good example of a movie clip that demonstrates OCD. OCD is that constant ritual and compulsions. Gotta wash my hands are dirty. Gotta wash my hands are dirty. And post-traumatic stress disorder, PTSD, is actually a very big disorder, especially people coming back from the military to the war from Iraq and Afghanistan. You're seeing a lot more PTSD. It doesn't have to be just people in the military. It could be anybody who witnessed or viewed or saw some type of traumatic type of evidence of an episode or catastrophic type of an event that can actually trigger PTSD. You also have delayed onset flashbacks, which means you could be fine for a year or so, and anything can actually trigger those flashbacks. Acute stress disorder, that's probably one of the most minor. It means something very stressful and then eventually goes away. Or generalized anxiety. Generalized anxiety is very common. That's kind of like the general worry wart. On average, over 44 million Americans suffer from anxiety disorders, and in general, you do see more women suffering from anxiety disorders than you do see men. However, what are some famous people that have anxiety? Howie Mandel, he's one of the biggest people you see that's got the OCD. He even shaves his head because he's terrified of having germs. And if you didn't know it, his wife actually will wash all his money before he touches it. That's why he always does this, and he won't touch anybody's hand. He's severely obsessive compulsive. Most people don't know Harrison Ford, big sense of social anxiety, and he's an actor all the time out in the public eye. Can you imagine what his social anxiety, how hard it is for him to do what he does as an actor? And then not Jim Parsons, even though Jim Parsons himself might have anxiety, but I put him in there. I'm sure we've all seen The Big Bang Theory, the one who plays Sheldon, Penny, 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 and all of his little rituals that you see from Big Bang. He is a very good example of OCD. What are some therapies or treatment modalities that is used for anxiety? Well, the first thing is anti-anxiety drugs. It's like a psychotropic medication. A good example would be Xanax. It's a really common drug that can help with anxiety. Individual group therapy can be very effective for anxiety. Cognitive behavioral therapy can be used. Those are trying to change those cognitions and your thinking. Exposure therapy, actually getting into whatever is that anxiety provoking situation and trying to deal with it in the moment. and what's called EMDR, which has been used on me. I don't use it really too often, but EMDR is where your eyes kind of flicker back and forth to create a flashback, and that's supposed to be able to deal with those flashbacks in the moment. It is used as an alternative method of treatment and used a lot with people from the military coming back for post-traumatic stress disorder. All right, guys, here is your entrance ticket. For your entrance ticket, you want to go into the Edpuzzle link that is on the PowerPoint slide. You want to click on it, then you want to log in as one of the students in the class. You're going to watch a really cool video, and I'm not going to tell you what it is until you come back to the next class, and there will be some questions about it, so make sure you watch it, or that is your entrance ticket into our next class meeting, and don't worry, it's a lot of fun. And these are the questions I want you guys to be thinking about when you are watching this clip from the Edpuzzle, from this clip that you will see from a movie. I want you to be able to name a symptom of OCD. I want you to be able to also identify what age can you begin to see symptoms of OCD, and what actor played Howard Hughes from the clip. If you watch the clip, you'll know exactly who that actor is. And the last thing I wanted to talk about is techniques to help manage your anxiety. You can read these, but these are some ideas. Maybe for next class meeting, you could come up with some of your own ideas that can help to manage stress and anxiety. Walk more slowly, talk more slowly, but I will tell you, class, one of the best ways to help manage anxiety, and there is research that shows you can go from a stress response into a relaxation response in seconds by using what's called diaphragmatic breathing. Read over this, and if you want to practice in class, we can do that. And the last thing to talk about is, can you think of other ways to handle your manage of your anxiety and stress? And can you think of any movies or sitcoms that illustrate these symptoms of anxiety? Example, Sheldon from Big Bang. Think about some ideas, because we're going to do a brainstorming in-class activity that will help you for your new assignment that will be coming up, where you will be analyzing your own movies or sitcoms. So see if you can come up with some real-world examples and movies or visual mediums that you have seen. Okay, class, please let me know if you have any questions. If you don't have any questions, don't forget to link into the Edpuzzle, and I'll see you next time. Bye-bye.